Good afternoon to our distinguished guests and participants. I'm Roshami Matrosli, Head of the Employment Service Division of SOCSO, Malaysia. It gives me great pleasure to be with you this morning for this event. First and foremost, on behalf of the Social Security Organization of SOCSO Malaysia, I would like to extend a very warm welcome to all participants of this event. Today, I will elaborate on the roles of SOCSOs in delivering better social support and the approach that are taken to ensure effective disability management during the current trying times. I hope that this keynote address will set the tone for subsequent discussions among our experts and practitioners from around the region to add value and enhance disability management practice in respective countries. Ladies and gentlemen, allow me to go through with you on the return to work journey and how we start in Malaysia. The Social Security Organization of SOCSO was established as one of the government departments under the Ministry of Human Resources to administer, implement and enforce the Employee Social Security Act 1969 and the Employee Social Security General Regulation 1971. The Social Security coverage has expanded as of 2018, where Employment Insurance System or EIS was established to provide income replacement for insured persons who have lost their jobs. Throughout the years, SOCSO has helped its insured persons to live their lives during unprecedented times by providing them with compensation and other monetary assistance. However, despite all these efforts, one should acknowledge that compensation could not replace productivity and performance. Thus, SOCSO holds a strong belief that prevention and rehabilitation will be able to ensure more workers are able to work in a safer and better environments, hence becoming more productive. Therefore, in 2007, SOCSO has established the Return to Work program, which not only focuses on rehabilitation, but is also able to introduce disability management, which aim to help the injured person who have injuries or illnesses to go back to work faster and safer through the concept of biopsychosocial and multidisciplinary approach. This effort is in line with the International Labour Convention 159 and Recommendation 169, which states that social security schemes should be able to provide or contribute to the organization, development and financing of training, placement and employment, including sheltered employment programs and vocational rehabilitation services for disabled persons and rehabilitation counseling. Each person shall consider the purpose of vocational rehabilitation is done to enable a disabled person to secure, retain, and advance in suitable employments and thereby to further such persons' integration or reintegration into society. This is the ultimate goals that we should be looking forward to in accommodating persons with disabilities in current situations and upcoming future. SOCSO introduced the Return to Work program in 2007 as a proactive approach in helping injured or invalid workers return to work when maximum medical improvement is achieved. This program is collaborative, a process that facilitates and monitors the implementation of recommended treatment plans to ensure that appropriate medical care is provided to the injured person. The case managers must manage the implementation and coordination of the rehabilitation plan with healthcare providers and the clients while promoting cost-effective care. The case management of workers is subsequently followed by effective employment services, which includes skill gap analysis, vocational training, reskilling or upskilling, and job placement assistance. In Return to Work program, every insured person will go through a systematic rehabilitation process based on biopsychosocial concepts, which include biophysical, psychological, and social factors that need to be addressed to help them return to employment. The case manager has a huge role to be filled. They will act as a liaison officer, planning all the rehab plans to assist the injured persons in returning to their employment. They also have to ensure that the case progress goes according to their plan to ensure proper practices and implementation. Besides that, they also will act as a coordinator and source of reference between the insured employers, hospital, and the SOCSO. In addition, the case manager also acts as an agent in promoting the return to work program in the workplace. Through the return to work coordinator, they will assist employers in developing and adopting the best return to work policies and practices that suit the workplace. Rehabilitation can help people with a wide range of health problems, including acute and chronic diseases, illnesses, and injuries. It can also complement other health interventions, such as medical and surgical intervention, helping to achieve the best outcome possible by providing patients with self-management skills and assistive goods they need, or by managing pain or other such consequences. Rehabilitation can help to lessen or slow down the crippling effect of chronic health disorders. Rehabilitation is a cost-effective investment for both individuals and society. It can help avoid costly hospitalization, reduce hospital length of stay, and avoid readmission. In line with the Return to Work program, SOCSO Return to Work Rehabilitation Center (TRRC) also offered medical services, physical rehabilitation, and vocational retraining to the injured person as part of the Return to Work program, which can help them participate in education and gainful employment while reducing the need for financial and caregiver support. Ladies and gentlemen, both employees and employers will be benefited from the Return to Work program. In terms of employees, they will be provided with psychological support as well as proper rehabilitation equipment to ensure that their therapy is effective. This program also helps them to regain their emotional and physical self-confidence as well as preparing them to return to work. For employers, they can retain and be able to keep their experienced and skilled workers, hence reducing their training and recruitment costs. Besides that, this program will help reduce sick leave rates as the early intervention practice, which is the core of return to work principles, have been implemented in their workplace. Allow me to share some key statistics for the return to work activities in Malaysia and their success rate. From 2007 to December 2021, you can see in the slide, 41,374 injured persons were able to keep their jobs. As we can see, the figure from 2019 to 2020 is dropped from 7,019 total cases to 5,286 cases of injured persons with disabilities who managed to secure employment when the pandemic reached the country. Moving forward to 2021, we can notice the number of the injured persons returning to employment increased to 7,163 cases as of December 31, 2021. This figure may point to a slightly higher yearly figure in 2021 compared to the year 2020 because Malaysia has been lifting the movement control order and allowing the economic sector to function. Aside from the physical aid and assistance provided to the disabled community, SOCSO Return to Work also focuses on mental health support for our injured persons. We provide psychological well-being and emotional support to employers and employees, especially those affected by the pandemic crisis. The COVID-19 pandemic is known to have mentally and emotionally affected people in the country, such as increasing anxiety, depressive mental state, and even burnout among the least vulnerable persons. Thus, one of the fundamental roles of our Return to Work department is to address these mental health challenges and issues during the ongoing pandemic. We aim to provide psychological support, as an early intervention measure to ensure a faster recovery among the patients. Among the approach that an initiative taken to ensure that emotional and psychological support can be delivered amidst the challenges of this pandemic era. The establishment of a guidance and counseling team, including Rakan SIP Prihatin, psychosocial well-being hotline, and implementation of webinar series across all states in Malaysia. The cost of disability is definitely high, and compensation alone is not enough. A proper and structured case management will help to lessen the impact that disability has brought upon which affecting not only them but also their income, salary, and also economy. With this in mind, one of our focuses should be on providing vocational training and entrepreneurship courses for the insured person in improving their quality of life by exploring other areas in which they can venture and focus to make a living. Upskilling and reskilling is important as it will open up demands in the labor market and more opportunities will be created in order for them to pave their own path, which includes self-employment as well. We also must fully utilize the gig economy through the entrepreneurship by encouraging the employer or business owner to create a job opportunity for the insured person. Through this, it will not only develop a set of skills required for a job, but also able to give opportunity for them to prove to others that they can perform the duties given to them despite their condition. We at SOCSO dream of having a Center of Excellence for Disability Management which will provide leadership, best practices, research support, and training for disability management. So far, we have collaborated with the Social Wellbeing Research Center (SWRC) University of Malaya to aid us with research and knowledge regarding disability management. We are extending our hand to more institutions or organizations to join us and further flourish the field of disability management in the region. With this, it is hoped that we can come up with a uniform practice in social security and disability management that will fit the regional and cultural context. SOCSO strongly believes that knowledge is power, and it should not be limited to what we have within these four walls. Besides that, we believe that awareness should be initiated and introduced in the system as early as possible. We have successfully created awareness among the employees by doing return to coordination training, where we provide training and educate them on the importance of accommodation. We are hoping that in the future we could offer a bachelor's degree program in disability management so that we can get more profession in the field of disability management in the workforce. However, we do understand that to create a bachelor's program will not be an easy feat. Thus, we plan to introduce a beginner course for disability management for the time being, targeted at university students to create awareness, environment, and importance to accommodate the person with disabilities or employees with injuries when they graduated. SOCSO Malaysia, as the authorized licensing body for Certified Disability Management Professionals (CDMP), is calling everyone out there, especially who are practicing disability management, to be certified with Certified Disability Management Professional or CDMP. SOCSO is also assisting other countries in the region by offering you all this certification program to further strengthen the practice of disability management in the Southeast Asia region. We hope organize multiple courses and examination series throughout the year, even during the pandemic, by using online medium. With this professional certification, it will be a catalyst in making a center of excellence for disability management in the region a reality. Moving forward, we must strive to give priority to the person with disabilities. Disability management's best result can be obtained when all stakeholders are involved. failure indeed can give a huge impact on disabled persons themselves, family, and the country. So, let's work hand in hand to ensure the disabled person will sustain themselves in the labor market continuously. We believe that the practice of disability management can create the awareness of more parties to the importance of accommodating persons with disabilities and give their right to contribute to the community. Last but not least, thank you very much for your kind attention and participation in this discussion. You can contact us through email at rtwsocso@perkeso.gov.my or visit us our website at www.perkeso.gov.my for more information and details regarding the Return to Work program. Till then, we hope to see you again. Stay safe, stay healthy, and thank you.